let's talk a little bit about children because you wrote about ADHD, this inability to pay attention, hyperactivity. Where's magnesium fall in line with that?
That's the neurotransmitter noradrenaline. We
Mm,
need that neurotransmitter to focus. And also dopamine is for mood too, right? So those two neurotransmitters to be formed in the brain require magnesium. And so that's why, you see signs of ADHD with magnesium deficiency due to the low noradrenaline. Well, and then we have medications too that try to boost that noradrenaline as well, along with the serotonin, and then the dopamine too for mood. So poor mood can definitely be caused by not getting enough magnesium.
yeah. And if we switch over to an aging population, we hear a lot about Alzheimer's, we hear about Parkinsonism, dementia. Even now, you not eat aging population, a lot of people are dealing with MS. These are all these neurological conditions, autoimmune in some cases. But how can magnesium benefit people there in both prevention and as something to utilize if you are dealing with these conditions?
So the synapses that connect the neurons, basically magnesium is like the miracle grow for those. So
Hmm.
those connections between our neurons. And so there's been certain studies. There's been at least two clinical studies looking at magnesium l-threonate, which is a
Hmm.
brain bioavailable magnesium, but also magnesium acetyltaurate or taurinate, sometimes called, also can cross the blood-brain barrier very well. And there's been two studies showing improvements in cognition as well as MMSE score in patients with moderate Alzheimer's disease or cognitive impairment. So giving a brain bioavailable magnesium may definitely help with cognition.
Another one that you touched on condition that seems to demystify a lot of doctors out there is fibromyalgia. What's the relation of magnesium in helping with fibromyalgia?
Particularly magnesium malate is the best
Mm,
one to actually boost magnesium levels in the skeletal muscle. And again, we need magnesium to make sure that calcium isn't basically overloaded in the skeletal muscle. And when you start overloading calcium, you can start getting muscle pain, and that can lead to things like, quote unquote, we're thinking it's fibromyalgia. But actually, studies have shown that 90% of patients with fibromyalgia may either be salt deficient or magnesium deficient. And typically,
mm.
getting one or the other can dramatically improve fibromyalgic pain.